For more, let me turn to Dr. Aliabadi. She's a renowned obstetrician-gynecologist and a leading expert on women's health issues and joins us from Los Angeles. Dr. Aliabadi, thank you for being on the program. Are you surprised by these numbers by the World Health Organization? More than 35 million new cases, cancer cases, by 2050. That seems like a lot.
Hi, good morning. It's a lot, but you know, as the population ages, the incidence of cancer goes up. There's a population growth, and most importantly, there are lifestyle changes that are affecting these numbers. Tobacco use, alcohol, unhealthy diet. We have an obesity epidemic right now, and as we know, several cancers are associated with obesity, especially in women's health: breast cancer, uterine cancer, liver cancer, colon cancer, kidney cancer, pancreatic cancer. These are all associated with obesity. Sedentary lifestyle is a huge factor. And of course, socioeconomic factors, poor diet, exposure to pollutants, and environmental factors like air pollution can all affect this number. It's really, really sad.
And as you mentioned, inequalities are especially jarring for breast cancer. Women in lower income countries are 50% less likely to be diagnosed than women in higher income countries. Talk to me about the importance of early detection, and also if you could touch upon your own personal experience.
You know, in general, when it comes to women's health, we still have gender inequalities. I've been in healthcare for 30 years, and I can really tell you that women's symptoms get dismissed. You know, in general, it's an education issue and it's an access issue. Women are less likely to be heard and to be diagnosed, and especially when you go to women of color, they're even less likely to get treated correctly. And there's still a stigma around surrounding women's health, which needs to be identified and dealt with. We know when it comes to cancer, early detection is huge. You know, the survival rate goes up. There's improvement in treatment success. There's reduced treatment intensity. The trauma goes down, and the quality of life significantly improves. So it's very important to detect these patients early. But I can tell you, as a women's health advocate, I've dedicated my life to educating women. I had to be my own advocate in the city of Los Angeles. As a women's health advocate, my cancer was missed, and I had to fight for a year to have the surgery that I needed to do, and finally my cancer was diagnosed. So it is, it's so many, at so many levels, this needs to be addressed, especially when it comes to women.
So the most important question right now for me to ask you is, how are you doing?
I'm doing great. Because of my own self-advocacy, I was able to diagnose my cancer stage 1, so I got surgery for it. Luckily, I didn't need chemo, but every time I went to my doctors and I said, I want to have this surgery, I want to have a double mastectomy because my lifetime risk was high, everyone told me, because I had no family history of cancer and because I was healthy and I, you know, didn't smoke, didn't do drugs, and didn't do hormones, and I wasn't overweight, that my risk was not high, but my risk was really 37%. So when it comes to breast cancer, it's so important for women to know what their lifetime risk is and how to deal with that number. You know, for breast cancer, if your lifetime risk is more than 20%, you fall into the high risk category, and you need to start imaging much, much earlier than what the guideline is, which is at 40.
So how do we change women being taken more seriously when they go to the doctor? In your case, it was missed the first time. You were your own biggest advocate. So what is your advice to women moving forward so the same thing doesn't happen to them?
The problem is, so it all starts with self-advocacy. They have to learn to be their own advocate, number one. But in order to be your own advocate, you need to be educated about it. So we need to educate women around the world. I still get patients in my office who say, I'm not going to get breast cancer because I don't have a family history. It's not true. Majority of women who get breast cancer, like me, don't have any family history of cancer. So be very careful. So education is important, but the issue is even when you educate them, they need to have access, right, to healthcare. Majority of women around the world don't have access to good healthcare. They don't get their mammograms in time. They don't have access to MRI in case they're high risk. They don't do genetic testing for cancer. And once, even if they have access, then they need to be able to afford it. And a lot of women, even when they know and they have access and they do their mammogram and they're diagnosed early, they can't afford the treatment. So as you can see, this is a very complicated situation, but it all starts with, step one is self-advocacy, step two is education, step three is access, step four is being able to make these treatments affordable.
And Dr. Aliabadi, we're running out of time, but very quickly, this study from the World Health Organization looked at 115 countries, found the majority of nations don't spend enough on cancer care and treatment. Men and women, boy, what does that tell us? That they simply don't make this a priority.
It's crazy. It's crazy. We need to invest more in our healthcare infrastructure. We need to invest in cancer research. We need to, improve telemedicine so a lot of people in rural areas can have access to care. We need to, educate, promote a healthy lifestyle, and reduce the risk of work-related cancers. I mean, the list goes on and on and on.
It sure does. Well, we certainly appreciate you being on the program and sharing your story with us as well, with some great advice for women everywhere. Thank you, Dr. Thais Aliabadi.
Thank you for having me.